We'll see if we can get through this in time without me going way over. So we're going to start talking about the pandemic and the effect on pediatric mental health. So the first thing I just want to talk about is basically go through what it's been like in the child psychiatry system leading up to the pandemic. So this is a really very brief history of child psychiatry and sort of 1 or 2 slides. Psychiatry started as psychology, really. So what we know is today psychiatry bloomed out of developmental psychology and analysis. That's why previously psychiatrists were expected to do therapy and diagnosis. Later, as we knew more, as we got more resources, the field split into what we know more as psychiatry and psychology. Medications became more available, research studies, and so with all this information, the split became even further. So I wanted to point out, if you're ever confused about if you're putting in a referral for psychology, psychiatry, parents don't know if they're seeing a psychiatrist or psychologist, therapist, there's a good reason for that, because historically we have still been figuring ourselves out just in the past 100 years. So our roles and what we do in psychiatry has changed a lot. And even within that, the people who practice psychiatry sometimes practice it differently. Some do more therapy, some do less therapy. So there's been a rapid evolution and change of the role. So it's good because there's more research, evidence, understanding, acceptance, within pediatric mental health. At the same time, it's confusing and exciting and scary. So the other thing is that now as a society, we have more time on our hands than we did, say, 100 years ago or longer. Before it might be we worked a lot more for survival across the board. Now we have time that we can be introspective, that we can evaluate what we do, that we can enjoy our children and not just put them to work in a factory. So we're at a place where we can be more reflective. We have the time. And because of that, I think that's why so much research is coming out and why we're realizing that there may be stuff going on with our kids that could have been there in the beginning back in the day, but we didn't really ever know because we just didn't have the capacity to be able to look. So we're starting to catch up. And as we start to catch up, we realize, oh my gosh, there might be something wrong with mental health. That might be an actual problem, especially for children. So I put on here a newspaper clip that came out in 2015, System in Crisis. So you can see here, even early on, even almost a decade ago, we were already realizing there was a problem. Now I could show you many slides of statistics of the shortages we have. Pretty much it's a shortage in everything. This was in 2017 or 2015, excuse me. This shows the shortage of child psychiatrists. And the red is severe shortage. So there's high demand, and we're also realizing there are a lot more problems than we recognized earlier. There's been a divide in how psychiatry is treated versus other medicine. So maybe insurance would pay for, a biopsy of something of a mole, but by a dermatologist. But in psychiatry, getting an eval covered really didn't become more acceptable, I would say, until the last several years. When I was in residency, we often still had to wait for a prior auth. So in this same study, they showed that basically more than half of the children in the United States with a treatable mental health disorder do not receive treatment from a mental health professional. One of the driving factors contributing to the unmet need is shortages in child psychiatrists. So we found the child psychiatrists increased by 22% from 2007 to 2016. However, 70% of US counties had no child psychiatrists in 2007 or 2016. Child psychiatrists were much less prevalent in low income and less educated communities. So you can see we're already walking into the pandemic with a problem. Even then, again, this is some of the information prior to the pandemic. And again, I'm just kind of touching on little things here and there. We could spend forever on the statistics of what mental health looks like in the world. So this is for kids 12 to 17 in 2018 to 2019. This is what they reported in the past year. 15% had a major depressive episode, 4% had a substance use disorder, 18.8% seriously considered attempting suicide, 8.9% attempted suicide. You can see these are pretty big numbers walking into the pandemic. So now then enter COVID. I'm sure you guys can see where I'm going with this, is what we needed was more help and we got bigger problems. So these, again, just some of the statistics, and a lot of the statistics are still coming out. So each year of the pandemic, they released a little bit more about what does mental health look like, but I don't think we're going to realize the fallout of the pandemic probably until several years from now. Once we see these kids start to grow up, we see what kind of delays occur, things like that, what happened to their parents. So this is a snapshot, but I would say in several years, we could say a lot more about this. So you can see here some of the statistics. A majority of adults reported experiencing undesired weight changes since the start of the pandemic. 2 in 3 Americans said they were sleeping more or less than they wanted since the pandemic started. Nearly half of Americans said they delayed or canceled health services. Nearly half of parents said the level of stress in their life has increased with before the pandemic. I was surprised that wasn't higher, to be honest. Essential workers were twice as likely than those who to not receive treatment from a mental health professional. Black Americans were most likely to report feelings of concern about the future, and Gen Z adults were the most likely generation to say that their mental health had worsened. Couple extra stats. And again, just part of the reason is when we talk about pediatric mental health, I really believe we're talking about family mental health, because kids do not exist by themselves. They exist in a system of family and schools. So knowing who's supporting them, what they're going through, makes a difference knowing for what the kids are going through. So you can see here, mothers were more likely than fathers to say their mental health had worsened. Fathers are more likely to report behavioral and physical changes. 1 in 4 essential workers diagnosed with mental health disorder since the start of the pandemic. So we're getting the idea that there are more problems coming on and fewer resources. So now when it comes to actual pediatric mental health, I put in this slide because the numbers all say something different. When we're looking at the rate of depression, the rate of ADHD, the rate of just mental illness in kids, I have found a whole slew of numbers. And because it is partially that aspect of we're still figuring it out, it's also partly because mental health and its role is new. The way we provide it, knowing who to ask, the stigma is still there. So you have to keep in mind, sometimes people aren't going to admit when they have problems. They aren't going to be able to seek help because of resources. So what I generally go with when I look at all the numbers and the general themes is that, and what I tell parents is basically since the pandemic, mental health problems in kids have more than doubled. Some of the individual stats also support this. So I thought this one was one that I read about recently. There was a release just recently, I think in February. Teen girls who persistently felt sad or hopeless increased dramatically from 2011 to 2021. So you can see here about doubled, right? So 30% to 60%. That's a huge number. And we all know, well, we maybe not all know, but feeling hopeless is a huge risk factor for depression and suicide. Leading into suicide, we have to talk about it a little bit. So what I want you to look at is the green boxes are suicide. So these are leading causes of death in different age groups. The green boxes are suicide. The orange boxes are homicide. We don't have the younger kids here, but one startling statistic is if you do see the baby rates, homicide is usually one of the leading causes of death, first or second often. So you can see here, the leading cause of death, one of the leading causes of deaths in young people is suicide and has been. Now, what's happening, it's interesting. So during the pandemic, the weird thing is the actual percentage of suicide in young people went down. There's we don't really know why. There are lots of reasons behind that, we think. And then when we came back to in school and everything started opening back up, that suicide rate shot back up again. What's also really concerning now, really, really concerning, especially for me in my field, is the amount of how people are killing themselves is much more lethal. I guess that sounds maybe obvious, but firearm has increased to half of the cause of suicides. It used to be a lot smaller. So it was always there a little bit, but for it to be half, that's a huge number. Now, one thing I want to point out is that for this half, it's across all ages and genders. So, even 10, 20 years ago, men were more likely or boys were more likely to commit suicide via firearm, and women were 4 times more likely to use pills or another method. Women killing themselves via firearm has gone way up. That's part of the reason why this number is high. Another reason this number is high is that younger kids are killing themselves with firearms. So I want you to take a look back at this slide. Look at the 10 to 14 age group. Suicide is the second leading cause. So what we're seeing is a trend of suicide. The means are getting more violent and the age is going down. So we have more 10 to 14-year-olds now killing themselves with guns than we ever did. One thing that's interesting, and I'm going to be honest, I'm going to present this data to you, but I literally have no idea what to do about it. I just think it's important to talk about. So suicide is much higher for kids when they're in school. So when they came back to school, we noticed a trend of suicide spiking. It had actually been the lowest, actual suicide rates had been the lowest it had been in decades during the pandemic. Now, suicidal ideation went up, but actual committed suicide went down. Then when kids went back to school, the rate jumped way back up again. What they have found, and this is different from the adult data, the children's suicides really correlate a lot with school. So you can see here, Mondays are worse. Starting school is worse. The summer months, Friday, Saturday, Sunday, are much safer. So you can see the darker numbers, the darker blocks that you look in here, more likely to see suicide. The lighter blocks, less likely to see suicide. This is a terrifying trend that we're starting to pick up on. And I am not trying to blame the schools when I say this, but I am saying that there's clearly a link with schools and we need to try and partner with them to figure out what we can do. Because there's a correlation and we can't just ignore it. So I was talking to my friend in education, and we're sort of arguing about it, which is interesting. Not arguing about whose fault it was, but I was saying, I don't know what to do when I get a 6-year-old with autism and ID who needs a parent provider. The staff isn't available. The parents are upset. The child gets upset, punches another kid. Then the school suspends the child. And the teacher admits to the parent, we can't have your kid hurting others, and that's why they need to stay out of school. And the parent says, well, if you had the appropriate services, that wouldn't have happened. So what do you do in that situation? And the weird thing is I put this example here, just heard it again yesterday. No joke. This is how common this is happening. And I don't know what the answer is. So I'm talking to my friend in education, and she was like, Burgundy, the truth is that we needed more staff going into the pandemic, and we got less. Now, since I'm telling you all the bad stuff, I want to tell you some of the good things. 4 good things about the pandemic and mental health. Reading to kids increased. Eating family meals with kids increased. Some people realize how much more we need mental health care. A lot of people have been living with their head in the sand of that we need more mental health care. And so it's not where it needs to be, but there now has been more of a desire to get accessible resources at a higher level than there was previously, maybe. Suicidal ideation in the pandemic went up, but again, suicide rate went down. So that's interesting. All right, jumping into my second slide. All right, so what should we know as professionals when we're talking to parents, when we're thinking about things for ourselves? And a lot of this may be obvious. It may be the standard stuff that you know. However, the way I see it is it's almost like mental health PPE. Just like how people had to be told over and over and over again to wash their hands and wear a mask, there's signs everywhere. Probably should have been obvious the first time we heard it to some people, but we still made a big deal out of it. I think that there should have been mental health PPE. I wrote on the bottom here, I wish that the PPE had said, don't come in if you're sick, wear a mask, wash your hands. Also, please genuinely ask someone how they're doing today, because we focus on the physical, but there was not the same kind of focus on the emotional or mental. Sure, it was talked about, but not in the same way that we talked about you need to wash hands. And I can see why, but at the same time, based on the suicides and everything, I also think it's just as important. So one of the big things is that you need to ask families how they're doing and listen and be hopeful. Again, sounds obvious, but we don't feel like we have the time often. But why should we do that? Why should you make a point out of doing that? I just want to give you some data on it. Thing is, helping caregivers helps kids. So it can feel weird if you're in a pediatric profession when the child comes in, they're the identified patient, or if you're at school, the student, therapy, the client, whatever. That's who you are representing. That's who you are helping, but you can't cut out the family piece. And the thing is, I think a lot of us have been struggling to figure out, how do we address the family piece? So I think people are thinking about it more, but I think we need to think about it even more. So one thing I want to point out is you don't even need to start by trying to fix the family or the caregiver. Just start by being curious, caring, and willing to ask what's going on. So I don't mean jump in there and say, hey, you're depressed. I need to put, I'm worried about your kids. I need to put in a referral to psychiatry. I think there are a lot of people who think that because they tell me that, but they don't necessarily tell the parent that. I'm not saying to start out that harsh unless you want to. If you feel like you can handle that, I do that sometimes too. But ask the parents when their kid's going through something during the pandemic, ask them how they're doing. Ask them how they're coping with things. Do they have support? And I really would like to emphasize, if you're going to ask it authentically because you care, not just because you're trying to check off a box, because people can usually feel that. Parents can feel the automatic, okay, how are you doing? And then they answer horribly and you go, okay, so now on to the child's problem. They get it. So just care a little bit more. I'm sure we care, but voice it. What you want to start off with is not forcing them to services. It's not trying to change who they are. But if you can be just a little bit of a safe person they can talk to, that you can show that you care, that can make all the difference for a parent opening up that they need help. I have to say, I really try and do this. And I would say about once, every couple of weeks at least, I have a parent who tells me, hey, I've been thinking about it. And I think to help my child, I need help. I need to see a therapist or a psychiatrist. Maybe they would have done that if they didn't trust me. But a lot of times I'm the first psychiatrist they tell that to, or the first doctor they tell that to, because they feel comfortable. And it's because I always ask the parents, how are you guys doing? And then they say, well, this isn't about me. And I go, yeah, but it is. I need to know about how you're doing. So if your interactions can only be 5 minutes and it doesn't feel like you have a lot of extra time, take 30 seconds to ask them how they are, knowing that you can't fix it, but that you're showing them you care by asking. We can provide psychoeducation. That's a big thing we can do. So I want to go over what the difference between psychoeducation and education is. Education refers to the provision of basic illness information, often supplemented by a pamphlet, website, self-help book. So it's basically like saying your child has depression, here's a printout. Your child has, an ear infection, here's a printout of otitis media. That's education. Read this book, education. So psychoeducation is important for multiple reasons. This is how you turn your education. Education is important, but this is how you ramp it up to psychoeducation, is you have to keep in mind the people in front of you. So parents walk in the meeting with different expectations, desires, fears, shame, guilt. And often that first meeting, you talk about really serious stuff. I can't tell you how often when I start an appointment, I'm like, hey, we're going to have a great time. And the parent looks like they're terrified, or there's this heaviness to it. And it's because they are coming in not knowing what to expect, being just so scared. I get that. When my child was in the ER and it turns out he had a kidney problem, all I wanted to know is, what are we going to do next? What does this mean? So I can see how when we already don't talk a lot about psychiatry, we don't know a lot, we don't have a lot of services, it's scary for people to walk into these situations. So what you do is when you address the person in front of you specifically, that's psychoeducation. So here's a cut and dry example of how you could provide both. Here's a book on depression. Here's a website on depression. Here's some basic stats, maybe some of the things we just went over. The psychoeducation piece would be, how do you feel about it? And then telling them, a lot of parents, when they come in, they feel guilty, they feel ashamed, and they shouldn't, or maybe that's something to work through, but they're still doing a good job as parents. So I tell parents that a lot of times, I know that it feels like it's your fault or you're doing things that don't work, but you're doing the right stuff. Clearly, I won't say that to people who I think are not doing the right things, but honestly, most people who walk in really are trying to do the right thing. So it's a pretty easy thing to say. I ask them frequently what their feelings on meds, therapy, whatever I'm doing. Now you can see here, I can ramble endlessly very quickly for a long time. I have the capacity to fill an hour at a high speed conversation and then go, oh, wait, did you have a question? So I have to stop myself. It's a reminder that I have with myself. When they come in first, I say, okay, what are your thoughts coming into this appointment? Are there diagnoses you're thinking about? Are there things you're coming in, you don't want meds? What's important to you? And the majority of times parents have a really good, a good thing to tell me, to let me know what they're thinking. And it's different so much. There's not a complete thing. I would say most commonly I hear, we're just worried about our child and we'll do anything that helps. But then I have other ones like, our family has ADHD. Is this ADHD? I want to do anything other than meds. You know, I'm scared because a child psychiatrist in the past provided this medication and it really messed up my child and I don't know why. People come in with way different expectations. And if you don't know what they are, that's going to impact treatment a lot of times. If they come in and all they want more than anything is not a med, and the first thing out of your mouth with treatment is, this is the med we're doing. And then they end up not following up with you. They end up not taking the meds. Well, that was a chance that you missed for them to tell you, hey, I don't want meds. You'd think they just butt in and say something, but it's uncomfortable for patients because the doctor is the authority and they don't want to have to argue with the doctor. They don't want to have to be disrespectful most of the time. And if they are, a lot of times it's because they've had to be a lot and it's uncomfortable for all of us. So what I will say, you know, like, let's say I want to redefine what they are seeing. I want to reframe it for them. I think that's psychoeducation. So, you know, I said your child, you know, I had this the other day. So I had a parent who said, is my kid just lazy or is it that they have an emotional problem? Because I don't want to punish them if it's an emotional problem. So you can see they come in with this very black or white view. And I have a lot of stuff to say about that. So I try and reframe it a lot. I wouldn't use the word lazy, but I would say they have struggles. This is the conversation I had just yesterday. I would say they have struggles. And some of those struggles are informed by their ADHD. No, I don't think it's ODD. No, I don't think it's purposely they're not listening and not doing anything just to get back at you. But their ADHD makes them less motivated, makes it harder for them to pay attention. And so it's going to be harder for them to do these things. That being said, they still need to learn how to do these things and they need your help. So it's not you just let it go because they have a mental health problem. And it's also not you judge it and then punish them. There's an in between. So I kind of go over that with a parent. So, you know, so maybe they're not listening to you, but maybe it's a possible thing that they're not listening because they can't listen, not because they're ignoring you. Doesn't mean you don't talk. That means you break it down into smaller steps and they need that right now. So that's psychoeducation. It's taking the education that's out there and specifying it to that family, to that patient. Psychoeducation is another reason that it's important is there's a lot of good research on it. So it actually can make a difference as an intervention. It actually can stop cycles, which is amazing. So you might think, hey, these are things that I don't have time for, or it's pointless, or the psychiatrist is going to go over it, or I don't know it. But taking those few extra minutes can really make a difference, not only just for the treatment effectiveness, but also for that parent being heard and for potentially stopping the cycle of things getting worse because they feel like they have an answer. They feel like an authority, a professional is letting them know, hey, we figured something out and we may not have the answer now, but there's hope. Taking the extra minutes just to go over that stuff makes a huge difference. There's just so much, pretty evidence for almost all things out there show that psychoeducation, above just education, it is a booster, hardcore to what you're already talking about and doing. All right, third thing. Now, describe strategies caregivers can take to improve their relationships with children in a post-pandemic world. So what I talked about before was sort of what you can do yourself, thinking about things, talking to the parent. These are things that I think you can tell the parents, educate them on. So most parents, I would say they're trying their best. I really think so. And they're coming to you for help. So when I see a parent that's super frazzled and overwhelmed, I remind them it's okay to take time for themselves. Now, here's the thing. I think a lot of people already do this. I think a lot of people in other professions, they get this. They know that self-care, that's been an important theme, is important to recommend to the parent. However, there's a difference in how you do it. A lot of times, and maybe I did this in the beginning, I think I did. A lot of times what professionals will say to parents is, I think you need to take time for yourself. So you need to go on a vacation. You need to get a hobby. You need to take a day off because it'll help you. And think about this parent who has 3 foster kids, all with behavioral problems, maybe intellectual issues, aggression. And you tell that parent, yeah, you need to get away for a week. And they know that no one's going to watch their kids. They know that they're going to get a call 20 minutes into leaving. What if that child injures one of the other children? So just saying this stuff is uninformed because it's being oblivious. Yeah, they need a vacation, but what's the realistic nature they can take it? So the way I do it is I still say it, but I reframe it a little bit. I say, you do need to take time for yourself. But what I mean by that is, let's say you're really overwhelmed with the kids. So you got these 3 foster kids, they're aggressive. It's, you love them, but it's so hard to cope with everything that's going on. What I tell parents is, when that happens, you don't have to solve it right then. If everyone's safe in that moment, walk away for 5 minutes and tell them, look, I need to go. Mom needs to go, kind of calm down a little bit. I'm upset. I want to make sure that I'm paying attention to my emotions and doing what I can to help myself. So in one way, it's a role modeling for kids to see a parent do that. So it's really good. Another thing is then they can walk away and feel okay doing it. Because I found that people who care about their kids, it's in the heightened moments that they feel like they can't walk away and they feel stuck, like they have to do something, but they can't, and they're getting burned out. I'm going to be honest, when I get overwhelmed with my kids, I try and say that. I try and say, Mommy needs some space. She's feeling a little overwhelmed. And then I go into my pantry, I close the door for like 2 minutes, and I just look at what food we need for the week. What is here and what isn't. Every once in a while, my husband catches me doing this and he opens up the pantry and he was like, "You just staring at the cereal? What are you doing?" And I'm like, I needed a moment. So those are the kind of things that I recommend for parents. You don't walk away for forever. It's not all or nothing. It's take a few minutes for yourself. One reason that's okay for parents, research shows that we spend even more time with kids than we ever did. We made it through the past on less time. We still had okay relationships with our kids in the past. Not everyone, of course, but we still got through as a society, continued to grow, continued to evolve. So we were doing something right. The thing is, they've shown, and I originally had the stats, but the time that we spend with our kids is like doubled than what we did even, I think, 50 years ago. And that's great. Like, that's wonderful. But then what happens is parents start to feel guilty when they're not spending every minute educating their child or doing what's right for their child. And they have that guilt. And I think society places that guilt. I think society puts a lot of guilt on parents. And I think sometimes as professionals, we want to scapegoat parents and say like, yeah, well, if the parents did this, then there wouldn't be a problem. But really, there's not usually as easy of an answer. And that's not very empathic. Really, what it is it's a complex situation and usually no one to blame. And we have to try and navigate through it. And one thing I do with parents is I say, what are you guilty about? You can not necessarily take your kid to Disney World as quality time. Yeah, if you want to, sure. But that doesn't have to be quality time. There's a study here that showed that, I loved how this phrase was, so I had to say the whole thing. The quiet in-between moments of family life did as much of the real work of family bonding as any fabricated time. So everyday activities, household chores, running errands can afford families quality moments, unplanned, unstructured instances of social interaction that serve the important relationship building functions that parents seek from quality time. So yeah, you can go to Disney, but also the quality time that helps them out, that grows them well and helps yourself can be doing the laundry. I try and tell myself when I make my kids do chores with me, I'm like, 1, I'm teaching them how to do chores, but 2, it's quality time. And 3, when I pass out from being so tired after this, I don't have to feel bad because I checked that off. Here are some small tips, and we're getting through to the end here. We should have about 10 minutes left. Some small things you can tell for parents. Try and spend at least 5 minutes of quality, undistracted playtime with kids. So I put a number to it for parents. This is not all afternoon, but I have some parents that figure since they can't spend a lot of time with their kids, then it's almost like they don't. I know one parent who works really long hours and he is exhausted when he comes home and he just does not have the energy to play with his kids. And he feels bad about that. Oh, hi, Kat. I hope everyone's okay with a cat joining us for this presentation. If you have PTSD from cats, I'm sorry. Maybe we can try and cut this out. So, but that parent, what I try to tell him is, look, set your timer for 5 minutes to play with the child. 5 minutes. And I'm going to be honest, that is what I do. When I am exhausted and at the end of the day, and I think I cannot take one more child whine, I cannot take one more mess of my child jumping, dropping out all these trucks on the floor. I just tell myself, Burgundy, get through for 5 minutes. I set a timer. And it's weird because when I do that, a lot of times I feel better, but if I hadn't focused on it, I might not have done it. Now, when we're concerned about people are coming out of this, kids are coming out of the pandemic, and it's like, okay, has this screwed up their social emotional development? They weren't around other kids. They wore masks all the time. I think people are kind of freaked out about that. And yes, there is some evidence that there is a bit of a delay in speech for many kids, probably because of the masks. It's not thought to be increases in disorders, but maybe a slight delay. But so if you want to try and help them, if you're worried about that they fell behind socially, emotionally, then practice at home, practice appropriate social emotional skills with kids. I'm not saying teach them, a lecture, but name your feelings. I'm feeling really upset and frustrated. I'm going to go take a break. It seems telling a child when they're crying, it sounds like you feel really sad, little things like that, or asking them how they feel. Don't press them. Don't be like, you need to tell me how you feel or else I'm going to freak out. That doesn't help. But just talking about feelings a little bit more. Ask them what they think, what their opinions are. All right, I'm going to get into it. I'm going to mention screens. Luckily, we have so many pediatricians who already talk to families about how screens are bad. I don't have to take that role. So I'm going to tell you the opposite. Not exactly the opposite. But what I'm going to say is screens happen. I can't tell you how many times parents are like, when they're doing the visit with me, they give their kid an iPad and they're like, I am so sorry. I know how horrible this is. Like, really, the guilt. And I'm always thinking like, I would do the exact same thing. And I do. Again, maybe I'm not making myself out to be the best psychiatrist or parent here, but at the same time, we have to be realistic. We live in a world with screens that are not only part of fun, but they're in school and everything. Pretending like screens don't exist is unrealistic. So what I say is if they're going to be screens, go with it. It is not about what the child is doing almost. It's what they're missing out on if they look at screens. So yeah, if you don't have a relationship with your child and all you do is sit them in front of the TV, screens are way worse than having a good relationship with your parents. However, what you can do is if you can bring that relationship into the screen time a little bit. And by that, I mean, when your child's watching something, talk about it. Say like, oh, I saw, Paw Patrol. Rubble is on the double. What is Chase doing right now? And I'm sorry, I'm not being paid by Paw Patrol. I'm not even sure if I can say that, but I'm just thinking of examples with my kids. Ask them what's going on. You don't have to nag them. You don't have to have them narrate it, but check in with them. It's funny, when I do that with my kid, he'll be like silent until I start talking to him about it. And then he wants to tell me everything that's happening on screen. Look, ambulance came. So that's good. For older ones, they're there watching the Kardashians. Ask them what they think of the Kardashians. Ask them who their favorite Kardashian is. For me, that would also be knowledge because I literally don't really know the difference between any of them. So I would be fascinated if a teenager wanted to tell me the difference between the Kardashians. So, but that's also good because you get insight into how they're thinking. Are they going to say, yeah, well, that one was married to a dude with bipolar and then she finally divorced him. And so it's really good for her. You're getting some insight into how that kid is thinking. Or what if she says, I can't believe she divorced him. He was the best thing ever, even though he was bipolar. It just gives you insight into their thoughts. One thing I also want to say is for you to tell parents and for you and for everyone is to work on finding your tribe. Spend more time with the people who support you and less time with the people who don't when possible, and encourage kids to do the same. So sometimes that's impossible. Maybe you don't love your mother-in-law to death, but she's the only one that can watch the kids. Okay, you got to spend some time. But for all those people that you're spending time that you don't want to spend time with, spend more time with the people you do want to spend time with. friends aren't all or nothing, but if you can get, if you're there stuck every day dealing with people you don't really like, or it feels out of obligation, then try and really put an emphasis on spending more time with the people you do. I think about this with collaboration. With the physicians, with the therapists that are willing to collaborate with me, I spend a lot more time with them, and I want to keep working with them more. The ones who don't, I do the basics, but I'm not going to do extra because they're not going to do extra. And it's not that I dislike them, but I'm not going to waste my time on that. So anyway, we're at the end. And now we can do questions and answers if there are any. And I don't know, should I leave this up, Coffee, or should I stop sharing my screen? What's better?
You can leave it up for a little bit so people can get your contact information.
Oh, okay.
Well, thank you for that first opening session. I am sure the information really resonated with so many people and what they were experiencing during the pandemic. So we're happy to take questions if you put your questions in the Q&A. And we'll address as many as we can before the next talk.
Did we actually get any questions?
Not yet. Oh, yes, we have. Is there any research coming out about potential reasons for higher suicidality during school sessions?
Oh, God.
Great question.
I know. No. So they're looking into it. So this correlation only came out more recently, and it was almost like shock and awe for people, where they had this idea that it might be correlated, and the more they looked at it, the more it was correlated. So there's stuff coming out right now as to why. There are only people guessing why, but they don't actually have research why. Some of the guesses are that bullying happens at school. Some of the guesses are that when kids were at home with their family, maybe they were able to bond more and feel more comfortable. Some of the guesses is there are more demands at school maybe than at home, and so that leads children to feeling more stressed out and feeling worse. But beyond that, we got to wait to see what the answer is. My guess is somewhere also where staff doesn't have enough staff, and the kids are dealing with social media bullying, and so it's probably a whole bunch of things. But no, there is no answers to my knowledge at this point when I researched it.
Okay, thank you. Okay, we have another question. What is a credible resource article for the effect of screen time on kids of all ages?
I don't know. So a credible resource, the American Academy of Pediatrics is what I would go to. I'm sure I can find the link and send it. So that's the thing. The actual credible source of screens is usually put out for primary care people to educate families on. It's almost like, what's a credible source for saying that breastfeeding is better?